Hi, my name's Sarah, and I'm going to demonstrate how to obtain a diagnostic ECG reading from a canine. So we have our patient here, and I have my EKG, the portable edition, here with us, and I also have my alcohol and a towel. So we're going to go ahead and get our patient positioned in right lateral recumbency, and we're going to get this ECG reading. So an ECG stands for echocardiogram, and it basically gives us a reading of the electrical activity going on in the heart. So it shows us heart rate while also giving us a demonstration of the heart rhythm. So this can show us things, what we want to see ideally is a normal sinus rhythm, which is your PQRS complex. And then you can also have things like sinus tachycardia, sinus bradycardia, and BPCs. So what we want to do is position our patient correctly and position our leads correctly so that we can obtain the most diagnostic ECG possible for our doctor. So we're going to get our patient in right lateral recumbency. So she's going to go right side down. I know, it's okay. Good girl. And we're going to put our leads on. Let me get them untangled real quick. Okay, so we're going to put the white lead goes right behind the right elbow. Okay. That's the left arm. Goes right behind the right elbow. Then the black lead goes right behind the left. The red lead goes in front of the stifle on the left hind. And then this ECG only is a 3-lead ECG. If we had a 4-lead, the green lead would go right in front of the stifle on the right hind leg here. Let me get a little bit closer. Okay, so it's okay. So we're gonna get her positioned as nicely as possible. If you can take that foot there. I'm gonna go ahead and moisten where the EKG leads are connected with some alcohol. And then the best thing to do is make sure that our legs are parallel, our elbows and our stifles are lined up, and that the legs are not touching each other, which is all looking good here. So our legs are parallel to each other and not touching each other. And then I'm getting my EKG reading here, which is giving us a normal sinus rhythm. So we have the PQRS complex here. And it's also giving us a heart rate. And then with this particular monitor, I can send this to a recording of it to the computer for our doctor. And when repeating EKG or ECG leads, ECG readings on a patient, you want to make sure that they're always positioned as similarly as possible for each reading for comparisons, and also that you keep them as calm as possible so that you get the best possible reading. Alright, and that's how you perform an ECG reading.